I had a request to do a video on inflammatory bowel disease, which is an autoimmune condition where the body's immune system attacks the intestines. And I see quite a few people with inflammatory bowel disease, but I decided to widen the topic and do a video on disability due to gastrointestinal, which is stomach and digestive system, and kidney and urinary system disabilities. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, there are basically 5 ways to qualify for disability due to problems with your digestive or urinary system. The first is if you have an organ failure. Organ failure in medicine means that either an organ has completely stopped working, and it has to be an organ that's important for sustaining life, or it's nearly stopped working. It's barely working just a little bit. The second is if you've had an organ transplantation, and there are multiple organs in the digestive and urinary systems that will qualify you for disability if you have an organ transplantation. The third is if you have complications of your condition, not necessarily related to the original system in which the problem lies. For example, in inflammatory bowel disease, sometimes there are associated problems with the eyes, skin, or joints. The next is if you have cancer, and cancers of the gastrointestinal and urinary systems are fairly common. Like all cancers, or most cancers, in order to qualify for disability, the cancer has to be severe. And that means there either have to be widespread metastases, the cancer has spread far from the organ where it began. For example, a cancer of the kidney that has spread to the brain would be considered to have widespread metastases. Or the cancer has to be inoperable. Surgeons have determined that there is no way they could remove the cancer by surgery, usually because it's attached to or very near an organ that they don't want to remove. For example, a cancer of the lung that is spread and stuck onto the heart, where the only way to remove the lung cancer would be to remove a large part of the heart, would be inoperable. The next is unresectable. This is where the surgeons thought they could remove all the cancer, but when they open up the body, they find that it's impossible. The one exception here for gastrointestinal and genitourinary cancers is cancer of the pancreas. The most common cancer of the pancreas is a very bad cancer with a very high mortality rate and qualifies just on diagnosis alone for disability. And then the final way to qualify is something that a lot of patients don't know of or are not very well aware of, which is the need for unscheduled bathroom breaks. Now, one thing that people sometimes bring to me, which will not qualify, is ostomies, and most commonly we're talking about a colostomy. An ostomy is when a surgeon has made an opening in the body for something to come out, and in a colostomy, the surgeon has attached the colon to the front of the abdominal wall, and the patient wears a bag, and the feces, the poop, comes out in the bag. That's not a pleasant thing to have, but Social Security, in their listing of impairments, says that they believe that people with an ostomy without problems or complications can work. Now, I'm going to talk about organ failure. In the digestive system, we're mostly talking about liver failure. And two of the common causes of liver failure, first are cirrhosis of the liver due to chronic alcoholism, and the second is hepatitis. There are many types of hepatitis, but the most common are due to viral infections, virus infecting and damaging the liver. Many of these viral infections of the liver, although not all, are related to addiction, because using dirty or contaminated needles to inject drugs is one of the most common ways of acquiring these hepatitis viruses. There is no such thing as an artificial liver. If you have liver failure, and if it's severe enough, you will die unless you have a liver transplantation. I'm going to talk a little bit about cirrhosis of the liver due to alcoholism, because that's the most common type of liver failure that I've seen doing Social Security disability exams. The liver has some ability to heal and regrow, and most people with cirrhosis of the liver from drinking, their liver will improve if they stop drinking. How much it will improve is unpredictable. I've seen people whose liver has improved a great deal when they stop drinking, and I've seen people whose liver has improved only a little bit when they stop drinking. It's important to know that if a person has liver failure due to drinking and they're continuing to drink, Social Security may not approve a disability claim because they are continuing to drink. So if you do have liver failure due to drinking, it's a good idea both for your own health and for your disability claim to stop drinking. Things are a bit different for people due to liver failure due to hepatitis they've caught by injecting drugs. Once you're infected with the hepatitis germ, whether or not you continue to inject drugs won't have any effect on the state of your liver. There are some antibiotics now which in quite a few cases can eliminate the hepatitis viruses, but whether or not you're continuing to take drugs may not be so important for a case of liver failure due to hepatitis. The pancreas is another part of the digestive system. It's a gland, and it makes digestive juices that help to digest starch, protein, and fat, and also several hormones, the most important of which is insulin, which regulates the sugar in the body. There can be failure of the pancreas, and if that happens, the person will have trouble absorbing food and may become malnourished and lose weight, and also will become diabetic because they can no longer produce insulin. There are pills that you can take that substitute for the digestive enzymes, and you can take injections of insulin. Also, the pancreas can be transplanted. Finally, there's intestinal failure. It's kind of rare, and I've never seen a case for a Social Security disability exam. But the intestines are important for absorbing the food and nutrients in the diet. And if the intestines fail, generally the person becomes malnourished and loses weight. There is the possibility of intestinal transplantation. If you have a transplanted liver, pancreas, or intestines, you qualify for 1 year of disability from the date of transplantation. After that year, you'll be reevaluated to see how you're doing. Hopefully, if your transplantation is doing well, you'll be in much better shape, but you're likely to lose your disability. Now I'm going to talk a bit about inflammatory bowel disease. Inflammatory bowel disease is an autoimmune condition where the body's immune system attacks a normal part of the body, the intestines, instead of just attacking things that shouldn't be in the body, like bacteria or viruses. There are two main types of inflammatory bowel disease: Crohn's disease, which mostly affects the small bowel, and ulcerative colitis, which mostly affects the large bowel or colon. Both diseases commonly cause abdominal pain, blood in the bowel movements, diarrhea, and often trouble with nutrition, weight loss or malnutrition, sometimes fever, and a whole bunch of other complications which may involve organs that are not part of the digestive system, such as the eyes, skin, nerves, or joints. Treatment for inflammatory bowel disease generally involves medications and sometimes surgery. It's usually a chronic disease that doesn't go away. Now I'm going to talk a little bit about kidney disease, and by far the most common kidney disease and disability claims is kidney failure. The kidneys are essential for life, and if the kidneys fail and there's no replacement, the person will die. The two most common causes of kidney failure in our situation are diabetes and high blood pressure, although there are many other less common diseases that can cause kidney failure. There is artificial kidney available. It's called dialysis, and there are two types of dialysis: hemodialysis and peritoneal dialysis, and I'm not going to get into a technical description of them. If you have kidney failure, you know what they are. If you don't have kidney failure, you don't need to know. Just understand this: if you are receiving dialysis, you qualify for disability. There is also kidney transplantation, and just like with the gastrointestinal transplants, if you have a transplanted kidney, you qualify for disability for 1 year after the date of transplantation, and after that you're reevaluated. Most, but not all, people who receive a transplanted kidney do very well and will be in pretty good shape a year after the transplantation surgery and will lose their disability. Now I want to talk about frequent bathroom breaks. Both conditions of the digestive system that cause diarrhea and conditions of the urinary system that cause the need to urinate frequently can cause the need for frequent bathroom breaks. I like to watch some attorneys on YouTube who are disability attorneys, and they say that they frequently win disability cases based on the need for frequent bathroom breaks. And here's why. Social Security wants to know if you can do a typical low-level, entry-level job. That's 8 hours a day, 5 days a week, with 3 breaks: a morning break, an afternoon break, and a lunch break. If you're having to go to the bathroom every 30 minutes or so, especially if when you get the urge to go, you have to rush to the bathroom or you're going to have an accident, they may consider that you are disabled, that you would not be hired for a regular job. I find that a lot of people with problems with diarrhea or urinary problems aren't aware of this. And in the ones who are, when I ask them how often do you have to go, the majority of them really have no idea. And this is the same problem as when people tell me that they can't do heavy lifting, and I ask them how much they can lift, and they have no idea. If you're claiming disability based on a limitation, like your ability to lift, or how often you need to go to the bathroom, you need to have a solid idea of the number of pounds you can lift, or how many times in an 8-hour day you need to go to the bathroom. In my next video, I'm going to be describing the best way to document the need for frequent bathroom breaks that can win your disability claim. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.